Hi, Stephanie.
Wow, good to see you today.
Thank you, and good to see you too.
Thank you. So yeah, Val, permit me to ask you a few questions.
Oh, please ask all you want.
Wow, isn't that awesome? Yeah. So, Val, what are hormones?
So hormones are natural chemical messengers. They can also be considered as signal molecules that are produced by your body, and they travel through the bloodstream to tissue organs. They work slowly with time actually, and they regulate your body functions such as growth, development, metabolism, and even behavior.
Wow, thank you so much for that. All right, Val, my next question is, what hormones are involved in a woman's development and reproduction?
Well, that is a good question. So there are a lot of hormones that are involved in a woman's reproduction and development, but the two major hormones are estrogen and progesterone. Now, estrogen is considered the number one hormone in a woman. Estrogen is produced in the ovaries, most of it. A little quantity is also produced by the placenta during pregnancy. Estrogen is very important in that it is involved in puberty. It is in charge of the development of the female mammary glands. It's involved in the development or growth of pubic hair. It is involved in menstrual cycle. It is involved in menopause. And also estrogen is actually involved in the protection of bone health, bone strength in both women and men. Estrogen is also involved in the cardiovascular system, skin, urinary tract, etc. So basically it is a very, very important hormone in a woman. And then secondly, we have progesterone. Progesterone, just like estrogen, is produced in the ovary. And some of it is also produced by the placenta during pregnancy. Now, the work of the progesterone is to prepare the uterine lining for fertilization. It also prevents the production of estrogen during ovulation. So these two hormones are the most important hormones when it comes to a woman's development. During pregnancy, there are also hormones that are involved that are important, like HCG, human chorionic gonadotropin hormone, and HPL. Now, HPL is produced by the placenta. HCG is produced and during pregnancy, and the production spikes from the 8th to 10th week. It is the hormone that is found in your urine when you go for pregnancy tests. That is the hormone they use to detect whether you're pregnant or not. And then there is also relaxin. This hormone is very important. It helps to relax the ligaments during contraction. So, after delivery, now let's be aware that estrogen and progesterone levels also increase during pregnancy. So after delivery, within the first few hours, estrogen and progesterone levels go down. Research has shown that the abrupt reduction in levels of progesterone and estrogen is one of the causes of postpartum depression. And then during perimenopause, that is the stage of crossing to menopause. At this time, estrogen level fluctuates and progesterone is on a steady decline. Now, because of this, there is fluctuation also in menstrual cycle. And after 12 months of not seeing your menses, then you are in menopause. So perimenopause is a stage of transition to menopause, and during this time, estrogen fluctuates and progesterone is on a steady decline. So these are how hormones, these sex hormones are important in a woman. These are the vital roles they play.
Right. Wow, thank you so much for that. And my next question is, how do hormones affect a woman's mental health?
It's very important that this question is asked because I think the modern day woman needs to know, needs to be informed.
Absolutely.
So, as earlier said, after childbirth, within the first few hours, the estrogen and progesterone levels decline. And studies have shown that this decline, abrupt decline in estrogen and progesterone levels could or have an effect or plays a role in the development of postpartum depression. And then there is also PMS syndrome, is mood swings during the luteal stage of your cycle. That's the period when the eggs is being released by the follicle. and it has to do with the estrogen and progesterone levels, mostly estrogen. But then again, there is PMDD, which is considered a more severe case. PMDD means post-menstrual dysphoric disorder. Now, this is a very severe case, severe enough that you need to consult your physician. Post-menstrual dysphoric disorder also happens during the luteal stage of your cycle, a week before your first day of release. You know what I'm saying? So when this happens, it comes with different symptoms. And if you notice these symptoms happen at this particular time of the month, every month, then you should know that you may be having this and see a physician. And these symptoms include depression, anxiety, irritability, loss of appetite, anger, sometimes getting violent with people. Oh, why are you laughing?
Okay.
So you see how important it is. It comes with even fatigue, sleeplessness. So it's just like any other mental disorder that needs serious attention. So this is how hormones affect a woman, and it's very important that we pay attention to this.
Right. So, Val, my next question is, in what cases would you recommend hormonal therapies?
Well, thank you so much for this question. I've actually been waiting for it. I would suggest hormonal therapy in cases of hormonal imbalance. And before we get into it, let's define what hormonal imbalance is. Not necessarily a definition, but I feel we need to know what this is. Hormonal imbalance is basically an overproduction or underproduction of hormones.
Right.
And there are various symptoms of hormonal imbalance. Of course, there is fluctuation in the level of hormones in a woman's body from puberty to menopause. But that isn't really what I meant by imbalance. What I meant by imbalance is actually conditions that call for medical concerns. There are different symptoms like hirsutism. Hirsutism is like overproduction of hair around the chest region, the face, the groin area. So, and there are other symptoms like there is hair loss, there is also vaginal dryness, vaginal atrophy, night sweat, a lot more. And what causes this hormonal imbalance? Two major causes that I'm going to talk about are hypogonadotropism and menopause. So the first one being hypogonadotropism. Hypogonadotropism is basically the underproduction of female sex hormones. And for hypogonadotropism, I would suggest hormonal therapies such as estrogen therapy or estrogen and progesterone therapy. Estrogen therapy if you had a hysterectomy, because sometimes it's not just about genes that cause this hypogonadotropism, because genes cause it, but sometimes it's due to an illness and you had to undergo hysterectomy. So if a woman undergoes hysterectomy, it's good for her to have estrogen therapy. But if a woman, let's say, is undergoing menopause now, this is where menopause comes in. If a woman is undergoing menopause, which means that she has a uterus, but then he's having this underproduction of these hormones, then she can get estrogen and progesterone therapy. Of course, there are risks and benefits of this hormonal therapy, but believe me, the benefits outweigh the risks, because when you receive estrogen therapy, it helps protect your bone, because during menopause women have weakened bones and loss of hair. So with estrogen therapy, it actually improves quality of life. Understand? So it's important to have a conversation first with the physician for you to talk about the risk and the benefits for you. Yes.
All right. Thank you so much, Val.
You're welcome.
So, regarding hormonal changes, what advice do you have for women in childbearing age and postmenopausal stage? And how can they improve their quality of life?
Well, thank you for this question. Well, the first thing I'm going to say is, girl, you need a me time. You need to take care of yourself. The thing is, if you don't sleep well, because you need to sleep, in fact, an adult is supposed to have at least 6 to 9 hours of sleep. So If you don't sleep well, you can't eat well.
That's right.
And if you don't eat well, you can't exercise well. And if you don't exercise well, if you don't even exercise at all, you don't get to live your life every day to the fullest. You find yourself always tired, drowsy, weak. So it is important to take care of yourself. That is the number one thing. Take care of yourself. Your body is priceless. It is. And when you're going through all these changes with hormone and everything, you also need to know that you are not the only one. We are all going through it together. Okay? And also, I really want to talk about this one. Remember when I talked about the postpartum depression? Now, it is sad that we live in an era where there are different trends going on, and people just go along with the flow without even trying to understand what this really means. There is this trend now going on about being a strong Black woman. And as said earlier, postpartum depression, one of the signs of postpartum depression is withdrawal. And it's sad that when a woman goes through something as this postpartum depression, she feels because she is supposed to be strong, she can't say anything about it because of what people will say. And statistics have shown that women with postpartum depression are mostly African, either just African or African American. And what even makes it sadder is that statistics also shows that 70% of these women don't seek for help. Please seek for help if you find yourself having any of the symptoms that I talked about previously. It is important to ask for help. In fact, what makes you a strong woman is the ability to know when to ask for help. Please take care of yourself. Know when to ask for help. Consult your physician. And for the husbands, please, postpartum depression is not the baby blues. It is a serious problem. It is a serious health crisis. Most statistics shows that 1 to 2 in every 6 women of childbearing age have postpartum depression after childbirth. So please, if you find yourself in this situation, seek for help. And men, please be there for your wives. Be there for them. They don't need you to tell them, it's just the baby blues, it will be over soon. Don't worry about it, it's nothing. When you do this, you make it impossible for her to actually open up to tell you about what she's going through. And people going through depression, whether postpartum depression or any kind of depression, so long as clinically depressed, they are supposed to have someone by their side that they can talk to. She needs you at that time. And you're supposed to be there for her. Tell her it's okay to seek a physician's help. To let her know she's not a bad mom. She's just in a bad situation. So please, I would really like that we all are aware of this, because it is a serious crisis in the world right now. And I know I talked about eating well. When I said eating well, I mean eating healthy. Drink some water, get some vegetables, take some fruits, eat healthy, have some lean proteins. Like, you don't have to eat a very huge chunk of meat all the time. You don't. And it's good to have good exercise to free your body. And you don't have to do strength exercises all the time. Sometimes exercise could just be having a walk down the street, like receive fresh air, okay? Just take care of yourself, because you are special, you are important. You don't have to carry on your shoulders more than you can bear. And even the Bible says that you should do no harm to yourself, to your body, because it's God's temple. And not eating well and not sleeping well, believe me, is another way of harming your body. So please take care of yourself. I keep repeating this, but please take care of yourself and ask for help when you need.
Wow, thank you, Val. That was so educating.
Well, thank you for having me.
It's a pleasure having you here this morning.
Oh, the pleasure's all mine.
Thank you so